Hello, I'm Amy Winans, Executive Director of the Association for Children's Mental Health. ACMH is the state chapter for Michigan of the National Federation of Families for Children's Mental Health. This video has been developed to help you and your community get some new ideas about strengthening family-community partnerships. It is my privilege to introduce the presenters for this video. Barbara Huff will be facilitating the discussion. Barbara is a mother and a nationally known family leader. She is the former executive director of the National Federation of Families for Children's Mental Health. Our second presenter is Kim Hunt. Kim is also the mother of 2 boys receiving services in Michigan. She is currently the director of the ACMH Family Center in Southwest Detroit. And our third presenter is Carrie Banks Patterson. Carrie is the coordinator of the Children's Initiative for Detroit-Wayne County Community Mental Health Authority. Thank you.
I thought it might be useful to maybe start the conversation with Kim. Let her tell us a little bit about the different ways in which they partner, what partnerships kind of look like.
Well, we have several different partnerships. One of the partnerships is that we have been working really closely. Families' involvement in the system of care is critical. So we've been sitting at all of the tables, committees, working with each of the system leaders. We also do a lot of work together and collaboration together with our family treatment plans. We're part of every aspect of those things.
Now that you've been doing this a while, as a family member in your own partnerships with service providers and also in your work, what do you see, Kim, as the biggest barrier to building partnerships?
We need to realize and to figure out how do we tell our stories in a way that will help system partners to understand and be able to kind of grasp and pull us in as partners and work together. We need a lot of training and prep to kind of get this together and to feel confident ourselves, to be able to sit at the tables and to be able to give information that'll be helpful. Sometimes it's very hard for us because we're so emotional, and I know for myself, my story is so emotional to me that it's hard to realize how to present that so that partners will understand what I'm really going through without really offending our partners, because I do realize, and our families realize, that they're doing their job, they're doing the best that they can, and we want to be part of helping them do that process.
It seems to me like there's been, over the years, families have not been valued. They've been seen more as the problem and not the solution. And in raising children with serious mental health problems, they've been looked at as the cause of the problem. And so getting over that hurdle and gaining respect it's been difficult, hasn't it?
It has, and for myself personally, I kind of learned a few things that kind of brought tears to my eyes and made me really understand what some of our families go through even more. I specifically came from a spot of being the director at ACMH. I had an opportunity to, in my own life, to kind of get to meet some of these system leaders and really partner with them. And through my team, my specific team for our family, it contained a lot of professionals on that team, and still yet we struggled with getting my children services, and I had top leaders, and so sometimes it's not specifically the system leaders but we need to get all of the systems to partner with us at each level, because I realized how hard it was for us as a family. And then I thought, wow, so many families go through this challenge of doing it all on their own and trying to get services. And I realized how difficult it is. And I guess that's what really made me value even more what ACMH has been able to do with families, is kind of provide that support through advocacy and helping them, because it is quite a challenge.
In talking to families over the years, one of the things that they have said to me is that one of the biggest barriers is accountability. No, and it's on both sides. Everybody wants everybody to be accountable. If you say you're going to be at this meeting, family team meeting at this time, we want you to be there at that time, family member. And in professional, if you say that you're going to be here at a certain amount of time, be accountable for that. That it's a real barrier to working together if you don't have good accountability. That people have clear expectations with each other, and that they are accountable to each other. Is that something you see and agree with? And do you train families on how to be partners at that level too? How does that really work, Cam?
Accountability is a huge thing on both sides.
Yes.
On both sides, definitely. And something that kind of goes along with that is the patience factor. For parents, we have to be patient. We didn't really get in this situation of our partners and system leaders being on one side and parents being on the other side. We didn't get there overnight, and we're not going to change that overnight. It's a process.
I think about this partnership, and I feel like everybody has certain needs that they have to have met in order to be partners and gain the respect of each other. And I'm wondering if you have some thoughts on what it is people need to be able to do this work together.
Transportation is a huge issue for us, getting to these meetings, and a lot of times we can walk only so far. Bus transportation can take you only so far. So that's a huge issue for us. We struggle with that all the time. Just kind of getting to these meetings because they are held at different places, and some of our parents really struggle hard and will spend 2 hours getting someplace where they need to be, and that's definitely commitment, but it's a struggle, and it's definitely a challenge to do that. But I would say that some of the other struggles may be something as simple as parents really want to participate, but childcare is an issue also. It would not go over well to be able to take your children and babies into a committee meeting where we're really discussing some things that need to have complete focus. But that's a struggle that our parents face because many of them have children at home, and some are school age and high school. But we still have a lot of our families and parents who have children at home, and that's a challenge for us.